Hello everyone, my name is Taylor Hayes. I'm the Director for Global Bridges and also Director of the Independence Center at Mayo Clinic. I want to welcome everyone to the meeting today where we're going to talk about developing curriculum in tobacco dependence treatment in support of the grants that many of you have undertaken. Next slide. So today we're going to provide some guidance and some resources to you, and we have a list of speakers from a number of different organizations who have a great deal of experience in the development of curriculum, who we think can provide some guidance as well as resources as you build your grants. Next slide. So there are no pre-existing curricula that you can use. There are many resources out there, but anything that you might find is something that you'll have to adapt to your local needs and to meet your learner objectives. So we'll provide you with some resources, and we'll talk about that today. But we also want you to be aware that you'll have to seek out those resources that may be available locally that we're unaware of. Obviously, if you find resources that are useful to yourself and maybe useful to other grantees, we'd like you to tell us about it so that we can provide that information to everyone. So we're going to highlight some building blocks today to help you get started. Next. So here are some, at a high level, the process that you need to follow in developing a curriculum. One of the first questions is the question about certification, and I think most of you will not be seeking certification from your training or curriculum that you're developing. You can see there are a number of issues regarding certification that you'll have to deal with. In the United States, there is an accredited agency that accredits all continuing medical education certifications, but outside the U.S. there are a number of other organizations in each country, and some countries don't have any organized way to accredit these continuing medical education credits. So most of you won't need this. If you do, we'd be happy to talk to you about resources that might be available to you. I'm hoping that this will not be a barrier for most of you. However, if your overall objective is to improve the quality of the intervention, we want you to be aware that it's not simply developing and delivering a curriculum, but you have to be able to assess it. And there are a number of levels of assessment that you'll need to consider. We've bulleted some of these here. At the very highest level, it's looking at the outcomes of patients who are treated by people who receive your curriculum. It's a more difficult measure, but one that we'd like for some of you to aim for. Next slide. We're going to provide some building blocks. Some of the organizations that you see listed here and the websites have some helpful resources for you, such as the Attitude Competencies. WHO has developed materials, and Global Bridges regional partners have developed some curricula, and we'll have those folks presenting some today. Next slide. Here are some additional resources for you. There are a number of organizations in the U.S. as well as outside the U.S. That we've listed here, and there are probably others that we aren't aware of or that are in development. Where we are aware of some curriculum development for distance learning in India, for instance, that will be available in several months. So as you're aware of more resources, please let us know and we'll add them to our resource list. Next. So with that as introduction, I'm going to turn the presentation over now to our series of presenters who will be able to provide you with some more detailed information about resources and help for you as you develop your curriculum. Best of luck as you progress in your grants, and please let us know at Global Bridges if we can provide you some resources here. Thank you.